My name is Lakita Higgins, and I'm going to talk to you about my remote collaboration and evidence-based care. We have a 2-year-old girl named Caitlin who was admitted to the hospital for pneumonia. She also had at birth the meconium illus. She's been having some recent breathing issues. She's been receiving a nib and also chest physical therapy for the thick secretions, and she also has some signs of malnutrition. Mother was talking to the nurses about daughter's sweat tasting salty. So a sweat test was done and she was diagnosed with cystic fibrosis. IV was started. Once the bio history was done, found out patient lives an hour away. So a lot of issues started coming up with problems. One of the problems was how would she be able to get her day-to-day treatments done appropriately because the parents aren't together and they also work long hours. The patient had also had a bowel obstruction, and the pediatrician also wants to monitor for DIS. Now, the patient's father, just recently started working, so they don't have a lot of money. So, social services is going to try to help them on that point to see what kind of help they can get. Um, so, for my care plan to incorporate in this situation, this patient, she has CHF, so she's going to have that for the rest of her life. What evidence-based practices that I would try to incorporate is providing adequate rest. Since she's 2 year old, she's gonna move around a lot, so she's gonna need her rest, and try to make sure she avoid fatigue. She needs to sleep in a semi-filers or with her head of the bed elevated, and that's to help promote lung extension and decrease airway collapse and dyspnea, and also using oxygen as needed. What that would do is relieve some of that dyspnea and also increase the level of comfort. And that comes from Martin 2023. For my evidence based practice model, I use John Hopkins. John Hopkins wants you to have a question: what evidence do you have, and also how would you implement it? So, my practice question would be: what is wrong with this child? You know, thick mucus, um, bowel obstructions. She had pneumonia, but what's causing all this? So, evidence, what did they do? They did blood work. They did, and by having the elevated stress test, she was diagnosed with cystic fibrosis. Um, what was done? What was implemented? IV was started. Respiratory therapist started NABs and physical therapy. And what we started doing is watching her O2 levels and her vitals. And that came from uh, upstate upstate.edu 2023. Since the cystic fibrosis affects mucus production, sweat, and digestive juices, doing the sweat doing the sweat test was appropriate because her sweat was salty, she was having thick mucus, and she was also having impaired oxygen exchange, and also watching for bowel blockage, which she already had, and IDOS was some of the complications. And I got that from Mayo Clinic 2023. Now, some of the benefits of an interdisciplinary was that the nurse, doctor, respiratory therapist, and a pediatrician can text each other, do Skype to get their information back and forth through each other. Some of the challenges was the pediatrician not being connected to a bigger hospital to get the correct information, knowledge insufficiency about CF, and also we don't necessarily know what medications, how the medication is going to get reconciliated properly between the chains. Um, and that was my remote collaboration and evidence-based practice assessment for